Good morning. Today I want to talk about one of the things that seems kind of common with Tourette's, which we could almost describe it as like Tourette's is a being really wound up disorder. So individuals with Tourette's are much more likely to have other challenges presented by heightened anxiety, meaning that they are more generally anxious or more responsive or reactive to anxiety, which I guess, as a brief aside, that's one of the main things that we're talking about when we say a person is having challenges or difficulties with anxiety or has an anxiety disorder. It's not that anxiety itself is a problem, it's that our bodies and brains become more reactive to anxiety, so that when the feelings show up, we become much more responsive. We experience emotional distress or agitation, and our brains kind of insist on doing something to fix it, whatever that may be. So one of the ways that we see this show up with Tourette's is that, of course, for one thing, that people with Tourette's are much more likely to report heightened anxiety or problems related to anxiety, including things like disrupted sleep, generalized anxiety disorder, possibly panic as well. But also, people with Tourette's are more likely to exhibit perfectionistic behavior, meaning that there's more of a feeling like it has to be done just right, things have to be perfect, I can't settle down until it is done well enough or done right. A lot of frustration comes about from this. So if a person is trying to do something and they're not succeeding, then the brain tries first to do it harder, to make it work. So one example we commonly would give is that if you push a button, and normally when you push the button it works, whatever it is you're trying to do, then if you push the button and it doesn't work, you don't typically abandon the button and quit ever trying again. Usually what you'll do is you'll try the button again, and then you might try a few times to see why it's not working. You might push it harder, as if it needs to just be pushed harder to work correctly. Now, it doesn't really make sense when we think about it. Sure, some buttons mechanically may need to be pushed harder to register, but that's not that common. And it's just really our brains will try harder to do something that has worked before. That's our most fundamental response to frustration. If a person is dealing with heightened anxiety, then their brain is saying that there's a problem and it tries to fix it, and if it's not fixing it successfully, then frustration tends to increase as the brain tries to make it work, tries to fix the problem, whatever it is. So, individuals with Tourette's often exhibit a lower tolerance for frustration. They may become more easily agitated or frustrated. They may be less patient. This then produces effects as well. So if I am getting frustrated, other people react to that. And maybe the way other people react is also frustrating, or that I don't like it in some way. Maybe they respond negatively. Maybe they get upset with me. And so then I'm going to be like, well, no, I want to get out of that situation because that's a problem. And so we end up with sort of this compounding cycle of things stacking on top of the frustration that was already there. And all kind of going back to an increased level of anxiety. To other people, this might look like a person is basically wound up or tense. So individuals with Tourette's often will appear to be more tense or more wound up, more easily frustrated, more perfectionistic, and this can lead to a lot of other challenges in itself. So one of the things we try to do is identify when this is happening. Notice in ourselves, like, I'm starting to feel kind of tense, starting to feel frustrated, and decide for ourselves how to take care of that. That might mean leaving the situation, asking for a break, or telling other people, like, I'm just kind of getting frustrated, I need to be left alone for a little bit so I can take care of this myself. So we can communicate, and if that communication serves the same purpose or the same function as the frustration, then our brains have another option that they can use. And we may not end up yelling as much. And we might like that result a lot more than when our brains got really frustrated and yelled at other people. So allowing ourselves that space, acknowledging that it happens, and teaching our brains that it's not a big problem when it happens. I have ways I can deal with it, and it'll be okay. Over time, this can reduce some of that tension and some of that stress, and gradually help us to kind of be able to deal with those situations the way we want to deal with them, instead of the way our brains sort of make us deal with them. All right, so that's all I wanted to talk about today. Again, you can always send me a message through galleon.tube@gmail.com. I think you can also respond possibly on whatever channel this shows up on, maybe. But that'll be it for today, and I hope you have a good rest of the day. Thank you.